Unaona kama ungeingia live.
Iko angalia
Upcoming question and answer session. Si ni kweli? Nenda live pale. Go live. Yes.
How's the camera?
Camera is very nice. Uko poa Karo.
Question and answer sessions. Your love the first live session.
How's the camera?
Hi. Good evening. Kindly comment, let me know where you're watching us from as I share the live. How was your day? Kindly comment, let me know where you're watching us from. How's your week so far? This is your Nurse Companion, the platform where we talk about different health conditions. And today is an ask questions and we answer is a live discussion. Last week you're supposed to talk about what to know before getting to theater, which did not happen. The live did not live. Yeah. So what to know before getting to theater or after the theater process. If you're a client, nangojea bado hapa kwa chat nisikie hi, how are you, how was your day. Niongelesheni kwa chat ndio niendelee hata mimi kuongea nisijiongeleshe. Tell me where you're watching from. Share the live with someone. Let me share it. Chris, help me have the link and share it. Send me the link so that I can share it. My day was amazing. A bit tired, but this year we show up despite being tired. I can't see anything in my chat. Let me know where you're watching from. And I'm so excited. This is a first live, successful live. Yeah. Where are you watching us from? Chris, I cannot. Chris, I will text. Let me see if I can. If I can see the chats because I can see nothing in my chat. Ah, good. I can see you. Say hi. How was your day? For me, I had a successful day. Oasis of Love Noah is following. Thank you so much. So where are you watching us from? But at least to figure out what time and then we start the session. Today's session, we are 3. Thank you so much. Just tell me how was the day. For me, I had a successful day. Thank you. Hi, I had a good day. Amazing. Where are you watching us from? Tumefika 5. Tunaanza session sasa, si ndio? So, of course, I am your host, Caroline Wanjiru Mwangi, and I am ready to discuss things that we did not discuss last time, which was preoperative and postoperative care. Yes, I am a midwife by profession, right now rotating at the theater. Nataka kujua, have you ever gone to theater? Hiyo mnaniwekea hapo kwa chat, naona. Have you ever gone to theater? Thank you so much for in Nairobi. Janet Wakothie, asante sana, karibu. Thank you, Nes. Have you ever gone to theater and what are the instructions yenye uliambiwa na daktari? And if you're comfortable, why did you go to theater? Ulikuwa umeenda kwa nini? Hi doc, hi Nes. Ukienda theater ulikuwa umeenda juu ya shida gani? Na what were the instructions told by the doctor for you to follow? For me, I went to theater. For me, I went for a CS section, so that was delivery. So for you, ulikuwa umeenda theater, ulikuwa umeenda juu ya nini? Na what were the things the doctor, you have been there, what did the doctor tell you? What are the things, instructions uliambiwa na daktari usifanye na ufanye? Uliambiwa nini na daktari ufanye? Hi Janet. Uliambiwa nini na daktari ufanye na usifanye? And did you ask questions? Why should I not do that? That is the preoperative care ama instructions ni hizo zinaambiwa before getting to operation, na kuna post ni ushatoka kulingana na ile theater procedure ulikuwa unataka unafanyiwa. So what were the instructions that the doctor told you to follow up? And I'll just get direct to the point. Let me connect my speaker and see if it's going to be any different. Can I make any difference? But I think I'm audible enough. Am I audible enough? It was a CS post instruction. Theater. Jano, hakuna anything uliambiwa na daktari ufanye na usifanye before you got to theater? Sawa, let me get direct to preoperative care. Get direct to preoperative care. Yenye unaweza kuwa uliambiwa na daktari ufanye before uingie theater. All these things zina differ from which procedure that you are undergoing then. So yes, a surgical care before operation, kuna preoperative, intraoperation here during the operation that is happening, and then post-operative phase. So I want to define kwanza preoperative care. Preoperative care is the care given before surgery. Things that are told to you before surgery. Now, why are you told these things? And then it begins when the surgery is decided. Ile siku yenye uliambiwa, maybe tuseme kama CS, kuna wenye wamebook. Like right now when you want to go and have another child, if you had a CS before, when you want to go to have another child, ukifika kliniki ya mwisho, like tuseme Janu, utaambiwa by daktari, on this and this day you will come, we shall have a CS. And then depending on which hospital, they will tell you, you need to have a blood donation done before the day of admission. That happens to different hospitals. Like the hospital I am in, you have to donate before ile siku yenye come kuadmitiwa for surgery, ndivyo kuwa kuna blood ready for you just in case you need it. Sawa sawa. So it starts from the time yenye daktari aliamua atakupeleka theater. Can be 2 weeks, can be 1 week. The information you are given and the care that you are given before the procedure is decided. Okay, the goal of it is to prepare the patient physically and psychologically. Ukijuanga ninaenda procedure next week, your mind gets ready. And like mwenye anaambiangu in the next 1 hour ama 30 minutes wako tukiingia theater, mwenye alikuwa ameprepare anakuanga physically and psychologically prepared for the surgery. I remember for my case when I wanted to go for CS, it was something that I was told in like I was not prepared, like a week prepared, all those things. And even myself, I had not prepared myself for an outcome. Nezenda CS. In my mind, I knew I will just go there, the normal SVD delivery. So getting kuambiwa unaenda theater, I was like, ilini hit differently. Expecting that you are a nurse, it would be maybe calm, but for me pia ilini hit. So knowing the preoperative care inakusaidia kuwa physically and psychologically prepared. Unaacha kuwa anxious, huna fears, and then ina prevent a lot of complication because you have enough time to research, enough time to ask questions, enough time to know more, even to ask your friends, yes yako ilikuwa aje, if you know you are going for it. Sawa sawa. And among the things daktari atakuuliza is, do you have any allergies za dawa, any allergies umekuwa nazo, maybe kikula kitu, anything that inaweza kuwa amiss. Atakufanyia physical examination kwa damu yako kama inatosha. Before then, how are your vitals, BP yako iko aje. Atafanya urinalysis, akina HB, among other things that will be done. Sawa sawa. And then ile siku yenye imefika ya operation, pia depending on the operation, because wanaweza atatuambia ile ya class 8 pia hiyo ni operation, hiyo hitaji fasting. Depending on the operation you're going to undergo, the doctor will tell you you need to fast, maybe not eat for 6 to 8 hours. Sawa sawa. And someone will ask, sasa kwa nini nisikule? Kuna mwingine atafikiria kwa akili yake, wacha nikule tu, daktari hanioni. I want just that. This is why we are having an educative session. Why should you follow these instructions? Sawa. Daktari akakwambia honest, usikule 6 to 8 hours because na hukwambia hata reason sana. Alikwambia usikule for 8 and 6 hours because you're going to in the procedure in the morning. So usikule from saa 6 usiku, asubuhi 6 ama 7 we shall be taking you to theater. Onesa aseme we hiyo njaa, no I can't. Kwanza ikisha delay 7 na waja kupeleka 8, unaona kauji kanapita, you're like let me sip this one, and you're wondering daktari hajaniona nini, daktari hajaona nikikunywa uji, so it's nothing. But one thing the doctor is telling you not to eat is when you are given the anesthesia ni hiyo dawa ya kulalishwa kwa theater. When you're given that anesthesia has different reactions. One, the body muscles relaxes. Zikirelax pia unaweza kuta kama kulikuwa kumekula, kunaweza kuwa na backflow ya food back to the mouth, and of course ukijaribu maybe kumeza or something, it may go back to the air ndio hiyo hewa, not ya food. Sawa sawa. So of course we are going to have choking, and you can imagine choking in theater and the procedure is going on. So sana sana when you're told not to eat, ndivyo kusikuwa na hiyo backflow ya food from the stomach back to your mouth. Okay. Hi, another thing that the doctor will still insist, if they have never told you, now I'm telling you because for future advice to your friends, is another thing is hygiene purposes. To make sure you are clean, you have bathed, you have shaved, if you need somewhere that needs to be shaved, like you had prepared yourself even before going to theater. Of course, when you go to theater, you are going to clean your place yenye surgery na happen. But when you have bathed yourself vizuri pia, una avoid easy but any dirt from the surface getting to the inner body. Yeah. So lazima kwa skin ikuwe prepared by bathing well. So hygiene is key. These are pre-operative care. Sawa sawa. To others, they will give you bowel preparation. Ile ni unapewa dawa, unapopu, una make sure everything is empty. Tulisema ukipewa dawa muscles zinaweza relax. Zikirelax kumaanisha hata huko chini zinaweza relax, zianze empty. So that's, some will be told to take, they will be given medication to make sure that their bowel is emptied. Other things, depending on the operation, will be told to remove jewelries. Hiyo ni kila operation, just remove your jewelries. If you have this, if you have another teeth ya kuwekwa, unatoa. These things I'm telling you, ndivyo siku ingine ukipeleka bishte yako theater, as much as daktari alibia kumwambia, ni vizuri kumuuliza, hizo umeweka nini, pete, we toa, earrings toa, meno ya kuwekwa toa, all these things. Why? Because meno ya kuwekwa, why? Ile time amelala hivi, si inaweza drop alafu itamchoke. That's it. Okay? That was physical preparation. I hope mko hapa na mimi sijiongeleshi. Thank you. For you, anointed worship, you have never had that experience, sawa? So that was physical preparation. Let me go to psychological preparation. One, psychologically, tumesema ukijua the procedure when it is starting, your mind is ready, you're physically prepared, you're mentally prepared. So mentally preparedness will come in the concept of the doctor akikuelezea, na wewe pia ukiuliza zile maswali like I'm going for CS, sawa? Daktari, why am I going for CS? Anakwambia reason, maybe mtoto amelala vibaya ama mtoto amechoka, mtoto so the heart rate inaenda chini ama iko very fast. Unaona akikuexplainia, at least now the anxiety drops, you have your answers well answered, your questions well answered, you are well assured of your state. Sawa, inapunguza your anxiety and fear. So those are among the things. Ask the doctor, how long will the procedure take? Yeah, what are the complications that are there before and after the procedure? What are the consequences? Which medication will be given to me? Nitalala ile ya kulala nusu ama nitalala kabisa sitajisikia? Those are the common things that when you know, now you are not anxious of the procedure. Okay. Sawa sawa. And then of course you'll be taught on breathing techniques depending on the hospital, like these things to be prepared well enough. And then on and the psychological, and of course for the legal purposes, make sure you have signed the consent. If you are under 18, make sure your parent, your guardian, and sign the consent. Why? Because this is a legal document. You can say they did not, I did not sign in to have the procedure done. Okay. So make sure, despite the procedures that you're going to get theater to undertake, make sure you have a consent, inaitwa consent form, umejaza kabla uingie. Sawa sawa. Those are the pre-operative care that you need. Make sure you know when you're supposed to stop eating. If you are on any medication, let the doctor know before you take it. Tuseme unakunywanga dawa ya pressure asubuhi na it's 6 a.m. and you're supposed to go to theater, kindly let the doctor know that you do have treatment that you take. Before you take it, niwakwambia ile dawa yenye unakunywa na yenye utawekwa kwa theater kama zinaweza kuwa na reaction. So let the doctor know before. Si ati ukiwa theater ni unaanza kumwambia ninakunywanga dawa ya pressure. Hapana, unamwambia before that I need to tell you I've been taking this medication. Is it okay? All right. So you tell them if you are on in chronic disease, because unaweza kuwa uko na shida ya sukari. Daktari amekwambia usikule for 6 hours. Don't eat for 8 hours. The next thing si sukari yako itaenda chini. So kindly mention if you are having any chronic disease, if you are having any medication. If you're having any medication. Okay. So we have said hizo story zote, like remind the doctor you have any treatment, you take any treatment, like you have any medication you're taking, or you have any chronic disease. Sawa sawa. Now we can go to post-operative care. This is when the surgery has already happened.